Will you explain to people why we should not settle for just having a Medicare option for people? Why public? Yes, thank you for mentioning that. We should talk about that. We should definitely talk about that. Why is public option not okay? What are the actual downsides? Let's just say we had a cranking fabulous public option. It was great. What's wrong with that? I'll be devil's advocate. What's wrong with that? I'll be Pete Buttigieg. What's wrong with that? No.
Well, it doesn't solve the problem. The $450 billion savings that Medicare for All generates, the public option doesn't. The relieving of people from all the complexities of having to choose an insurance plan or having their boss choose an insurance plan, that still happens. The public option doesn't eliminate out-of-pocket expenses. When I said Medicare for All doesn't have co-pays or deductibles, public option, they're talking about it still would. The public option is a way to bail out the insurance industry because the public plan will, on the natural, attract people who really need healthcare because the benefits will be better, it will be a little less expensive, maybe the co-pays are lower. Well, the people who need care will flock into that plan. And you can talk to your folks in the insurance industry in Des Moines and Omaha, and they will tell you the insurance industry is very good at marketing plans to young and healthy people to make money. And so the private plans would exist in parallel to the public plans. Private plans do great, public plans overburdened. What happens? What's the scenario? The end game is, once again, public plan discredited because they can't sustain that. And the private plans say, see, we told you so. So the public option represents a false choice. It's marketed as, oh, it's the same as Medicare for All, just costs less. But that's not true. It's not comprehensive, doesn't have the same benefits, doesn't eliminate the co-pays, doesn't save money, and really doesn't guarantee healthcare for all.
Right. And that's what I've typically said to people as well. And I've also talked about the Affordable Care Act when that's been brought up. And I've said, look, we've already played with the idea of these like public exchanges, and where we've had that, they've left. It's not profitable enough for them. I mean, we've got down at one point to like one maybe provider for a little while in Iowa, literally one. Everyone else had left the exchanges because it was mostly, sort of the people that didn't have health insurance through their job, that made a little too much money to be on Medicaid, but not enough money to pay, these ridiculous prices.